Hello, this is Tessa Kegel and this is HPS 5 OHC, Personal Assessment Monitoring and Pre-Employment Screening. So this is Module 9 and Part 1 of 3. This is the Commonwealth of Australia Copyright Act 1968, which covers this material. The objectives of this module are to access, interpret and apply information about the use of pre-employment screening and health assessments, to identify the appropriate requirements for and use of expert assistance when developing and implementing appropriate pre-employment screening and health assessments. And finally, to consider the legal and ethical applications for pre-employment screening and drug and alcohol screening in the workplace. Health assessments and monitoring are important components for management of workers' exposures to hazardous substances. Common protocols include pre-employment assessments, fitness for work assessments, and employee monitoring. Employers have an obligation to inform prospective or current workers of any risks or hazards associated with the work which is to be undertaken. Now, this should assist individuals to make an informed choice about their fitness for work, but it does not absolve an employer of their need to take all reasonable care to remove hazards and generally in relation to preventing workplace injuries or accidents. In previous modules, we've identified primary, secondary and tertiary prevention of workplace-related injury and disease as the cornerstones of occupational health practice. In this module, we move into the area of assessing individuals, either for their fitness for work or to measure their exposure to certain work practices or substances. These areas form part of the prevention spectrum only if the process is used to feed back to the workplace regarding the related hazards and risks, and then to change working environments to prevent negative outcomes or injuries. Individual worker assessments can be used to pick up health conditions which may affect people in workplaces or for a variety of return to work situations. In this module, we examine personal medical assessment of individuals within occupational health. Screening is commonly performed to assess the fitness of people for work. The most common situations that involve screening in occupational health setting are pre-employment, pre-placement of an individual into new work with different demands or requirements, before to return to work after a specific injury, to assess the level of impairment or disability of an individual, executive screening for individuals in senior roles, screening for drugs or alcohol, and for periodic assessment of workers with known workplace exposures. And we'll discuss this final one in greater detail in the next module. For an assessment to be useful, the assessor needs a fundamental knowledge of the work environment and the task required by the job. Screening is a medical procedure, and confidentiality of a person's medical history, consent to provide information to a workplace, and provision of adequate counselling regarding outcomes should always be kept in mind. Advice given to management or personnel about the results of occupational health survey or medical examination should generally be confined to advice on ability and limitations of function and within legislative confidentiality requirements. Findings should only be expressed in general terms, excluding clinical findings. The exception to this is during legal procedures such as a claim for compensation when clinical diagnosis information may need to be revealed. Cox et al. Lists the main areas in which assessment is used as a person's condition may limit or prevent effective performance of a job, a person's health may be made worse by the job, a person's condition may make them unsafe to do the job, the condition may put both the person and others at risk, and the person may put the community at risk. Pre-employment screening. Pre-employment screening is used for a variety of reasons, some of which may be undertaken for historical reasons and not all of which have any validity in decision-making about a person's potential safety in a job or their ability to do the job. Pre-employment screening aims to provide a baseline on an employee for further future reference for both personal reasons and for epidemiological research, to assess that the employment or tasks will be within the physical and mental capabilities of the person, to help ensure employment will not aggravate a pre-existing condition or precipitate a condition in a susceptible person, and to help ensure the person will not cause another person harm. Other reasons for pre-employment screening include to identify previously unrecognised or inadequately managed health problems, to document previous work injuries, previous occupational and non-occupational exposures to potential hazards, to provide an opportunity for health promotion, health counselling and company information on health and safety, to enforce the use of safety equipment and instructions on correct use, to deny or restrict employment when increased risk is detected. Pre-employment screening may be used to comply with occupational health and accident compensation legislation and specific substances regulations, for example with lead and silica. And again, we'll be discussing this in more detail in the next module. To comply with superannuation requirements, however, this is not necessarily the case in Australia. As a part of legislative requirements, for example, in relation to asbestos or commercial driving. For infection control for the food industry, so this is product safety, or health services, for example, patient safety.